Welcome to Medicare 2025. My name is Corbin Lindsay of Birdseye Financial, and we're going to try to do something new this year, something that might be very helpful as a resource for you. First, let me introduce my team. You know myself and Beth Daniels, my office admin. She helps us with all of the paperwork and applications. We also have Angie Kessler Walsh, who's been helping me. This is her second year working with me. She's done a great job on explaining Medicare plans to our clients. So this is our team. If you have any questions, let us know. You can see the other services that we offer. All of our planning is at no cost. Let's go ahead and jump into Medicare plans and talk about what's available to you. Today we're going to explore the HMO plans. And with the HMO plans, most of my clients are on the Humana Gold HMO. The plan number is this one here, H2486-006. That's in the bottom right-hand corner of your card. That's the plan that you have for 2024. I'm recommending, after going through the different plans available, most people are on Humana because of network size. I'm recommending the Heinz 57. Actually, the last three digits is the way I'm remembering that, the 057. So we're going to go through this, and by the time we're done, more than likely, you're going to want to switch over to the 057. During this presentation, I hope that you take some notes of some areas that are important to you, some questions that you might have for myself or Angie when we talk with you. But this hopefully will save you some time, allow you to go back and watch different sections instead of just rushing through trying to understand everything within a half an hour. So that's why I'm making this for you. I'm also including this one other plan over here. It's called the 059, and the 059 does have a monthly premium, but it's exclusively unique in that it has one of the lowest maximum out-of-pocket costs that there is. So $65 is over $700 a year. But 65 times 12 months, and then you have a maximum out of pocket of 2,900. If someone's going to max out their plan and they cannot get onto a supplement due to health issues, that might save you a lot of money compared to maxing out at 5,900. Not everybody does max out, but if they were, this would be perhaps a better option. So let's get started. I'm going to compare first the plan that you may have and the plan I recommend, the Heinz 57 plan, if you don't mind me calling it that. First off, the premium is zero for both plans. The plan, if you keep it, will have a $130 medical deductible. What's included in that? Well, in that deductible, the exclusions, I should say, are if you had ambulance service, chemo drugs, diabetic monitoring, emergency room lab services, pneumonia shots, flu shots, Part B insulin drugs, Part B drugs such as chemotherapy, doctor visits, specialist visits, and urgent care. What may not be covered, which means you will have to pay the $130, would be such as outpatient services, hospital services, any type of facility costs could have that $130. I prefer the plan in the middle. That's the one I'm recommending. The Heinz 57 has a zero medical deductible. Both plans have the same in-network 5,900. Keep in mind with an HMO, you do need to stay in-network. The exception to that is emergency and urgent care. You are able to go anywhere in the world. But if you're in the state of Washington and you're on the HMO, you're going to want to make sure that all of your doctors are in network. And that's the importance behind a referral. Drug deductible is being instituted on the current plan, so 200, but the plan I recommend has a zero drug deductible. What is a drug deductible? Well, let's go back and talk about that for a second. There has been significant changes to the way the drugs are structured for this coming year. First off, let's go back to 2024 as an example. There was 4 stages. The first stage was a drug deductible that only apply to really your brand name drugs. Brand name drugs being tiers 3 and 4, specialty drugs tier 5. If you were taking a generic, more likely the drug deductible would not have applied. Now, if I look at the initial coverage, that's after any drug deductible might apply. If you and the insurance company add up to $5,030, then you go into the coverage gap. Most people stay in the initial coverage stage, and it's going to be 25% of the cost of drugs or less. Most of the time, it's less. As you know, with generics, some of them are free. When you get into the drug deductible, it was a 25% cost for those drugs. If someone tapped out at 8,000, they went into catastrophic, which this year 2024 was free. So what happened with Medicare is they took away this coverage gap, and instead of a combined total of $5,030, it's now a maximum of $2,000 out of your pocket. That's the maximum that somebody can pay in a calendar year. No deductible for tiers 1 and 2 generics, but there could be a deductible as high as $590 for tiers 3, 4, which is your brand names, and tier 5, which is your generics. So let's go back for a second to the plan. We can see that on the Humana plan that you currently may have, there's going to be a $200 drug deductible. The one I'm recommending has a 0 drug deductible. And the initial coverage is maximum that you would be responsible for would be $2,000. Now, not everybody has $2,000 worth of drugs, but if you did, that would be the maximum that you would be responsible for. The maximum out of pocket for medical and the drugs are not the same number. So somebody could have a really bad year, spend $5,900 on medical and another $2,000 on drugs. Does that make sense? I hope it does. Okay. Going down to the first category, acupuncture, $50 versus 0. Additional services like fitness benefits, that's included on both plans. But take a look at this plan in the middle. Alternate therapies. What does that include? Well, so many of you like and want and desire naturopath services. Naturopath, chiropractic, acupuncture, that's all considered alternate therapies. In this case, it's naturopath, 25 visits per year. We come down, ambulance. Now this is the weak spot for Humana. Humana is a little bit more expensive on the air ambulance than most everybody, but ground ambulance is $315. No changes there. Air ambulance $1250. Come down to chiropractic services, $20. 12 routine exams or treatments, I should say, per year. Normally that's subluxation of the spine. Now, here's a big change this year. Dental services, the plan that you currently have went from $2,000 all the way down to $1,000. Keep in mind, this is a free benefit, but probably because of the cost of Part D now being more on the backs of the insurance company, they have to trim back some of the extras. So the dental went from $2,000 to $1,000. However, if you take the Heinz 57 recommendation, you actually bump up to $3,000. So you move from $2,000 up to $3,000. I think that's a great deal. Diabetes, no changes in that. The diagnostic testing and radiological services, that might be blood work, x-rays, that sort of thing. You'll notice that the price has jumped up from $390 to $538 maximum. That's pretty high. The plan I'm recommending will keep your price the same at $390. Therapeutic radiological services, that is cancer related. That is very expensive. Some plans with a price might actually reduce that more, or you might ask me about a supplement. But going back to the MRIs and CT scans, that's kind of the one that we keep our eye on. So I'm not very happy with the current plan that you have when it renews in 2025. I think you should switch to the one in the middle. Doctor visits, both of them are 000 across the board. Specialists are $50, going up from $40, went up to $50. I'm sorry, let me restate that. Your plan was $25 and it's going to $50, and the plan I recommend will keep it at $25. Durable medical equipment, oxygen wheelchairs and walkers, that sort of item has always been about 20%. Emergency care. $125 went up about $5. I believe it was 120 last year. Now it's going to be 125. If I go down to hearing services, I'm not seeing any hearing aids or routine hearing exams, but on the plan I recommend, you still keep your routine hearing exams. Hearing aids this year are going to be priced at $399 to $699. Home health, that is a category when you come home from the hospital and you need extra help. Maybe you need a nurse, or maybe you need to talk, or not talk with, probably will talk with, but you need a physical, occupational, or speech therapy to come to your house to help you adapt. That is always included at no cost. Outpatient mental health, zero across the board. Outpatient prescription drugs, that's where we start talking about chemotherapy. Very expensive. Chemo comes in different flavors, different ways. It can be anywhere from 0 to 20%. If you are dealing with cancer, you might want to consider either the plan on the right that has a much lower maximum out of pocket, or talk to me about a supplement. Outpatient rehab services. Several categories. You might go for rehab for cardiac pulmonary. That's pretty cheap, $10 or 5. And then we have the rehab, the occupational, the physical, the speech therapy. This is the number I was quoting earlier when I said 40. It's $40 for 2024. It's going to jump up to $45. Not a big jump. But the plan in the middle is really good, $20 for each visit. Maybe you have to go multiple times. Outpatient surgery, you go meet with the doctor and they need to do some type of a biopsy or some type of a surgery. Maybe you're having your eyes done for cataracts. The plan on the left that many of you have will jump up to $538. The plan in the middle will be $390. So that's, again, why I recommend it. If you're going to a surgical center, it's a little bit cheaper than a hospital. Surgical center would be $400 instead of $538. And it's only $200 at a surgical center instead of $390. So if I'm looking at your 2024 plan, it is currently $390. So the plan in the middle would keep it the same. And for a surgical center, your plan currently is at $100, so that would be an increase to about $200 if you went to a surgical center. Still much better than paying $400. Outpatient substance abuse is included. Over-the-counter items has gone away on your current plan. I believe it was $40 or $50, $40, I believe, 45, something like that. But the plan in the middle is jumping up to $60 every 3 months. You use it or lose it. This is a great category for getting vitamins, minerals, bandages, cough syrup, that sort of thing. It's mostly generic items, but it's a great way to stock up without spending extra money of your own. Podiatry services, that's going to be for your feet. So 50 on the left, 25 in the middle. Not bad. Preventative services, this is free and the same across the board for all plans. So that could be a bone mass, it could be a colonoscopy, it could be depression, it could be glaucoma, it could be mammograms or prostate checks, depending on male or female. And there's also your shots included along with a wellness visit. Prosthetics, hopefully you don't have that need, but they do have to cover at least 80%. That means that you would have 20% your cost. Renal dialysis, same thing, 80% is covered, 20% your cost. Now we get down to urgent care. So we talked about emergent care, which is worldwide. Urgent care is also worldwide. $55 in the US, $125 outside the US. Some changes here was vision services. The current plan that many of you have will no longer have routine eye exam or glasses. But according to the plan, the one I recommend will have $350 of glasses. So instead of $200, it's going up to $350. And same thing, free eye exam. It's important to note that they're going to be changing their network to what's called the Insight Network. If you use one of their preferred plus providers, you get the full 350. If you use one of their standard providers, then you get 300. It's $50 less. There is no Flex card available this year. I'm sorry to say, I know that's a disappointment to many of you. Again, the company has to more likely trim the fat. That's a great perk, but Part D is probably going to cost them a lot of money by the way it's structured. If we move over to Part A benefits, that's hospital, inpatient hospital care. Ouch, jumps up to 538 for days 1 through 5. The plan in the middle I'm recommending is 390 days for 1 through 5. Currently, your plan was 390 for 1 through 4, so that is a little bit of an increase on the hospital as well. If I mention inpatient mental health, you'll see the pricing is 458 versus 390. And then finally, skill care. Skill care is if you're in the hospital and you need to move or transfer over to skill care, then it's $10 for the first 20 days and $214 for days 21 through 50. Once you would max out your plan, more likely if you hit 50 days, but not everybody does. I think this was 203 for the current year, so it's going up to 214. But if I add up all these copays and any of these out-of-pocket expenses, if I get to these maximums of 5,900, that's the most that you have to pay. And that's how we look at what is the risk for medical. Well, that concludes my plan suggestions for you. I will let you know that on my website, I have some recommended HMO plans and PPO plans. So if you click the HMO plan and you go to that link, I'm going to have this video sitting here. I don't have it here yet, but you can download your current 2025 plan summary and evidence a little bit more detailed. And you can also download the recommended Heinz 57 plan, that I like to call it. There's a summary and the evidence. And then if you're looking for a really low maximum out of pocket, I also included that plan here. If you want to see the side-by-side that I just did, you can also click the side-by-side. If you want to explore the PPO plans, which we're going to talk about, you can just click this button for more information. Well, thank you again for your time, and I always appreciate helping you. I look forward to either meeting with you or Angie this year to discuss your 2025 Medicare needs. Thank you. Have a great day. Bye-bye.